The decision on which type of procedure is a long conversation, and it has to do a lot with what diagnosis we're dealing with. Are we doing it to try to avoid surgery? Are we doing it with surgery? Are we doing it after surgery?
I really enjoy having some of these other options to offer patients for treatment, because either for either the conditions that maybe we don't have a perfect answer for, we don't have a surgical procedure that necessarily is a cure or a fix, or any kind of other therapy. So it gives us an option for some of these problems that we don't have other good options for. The other scenario is some patients that maybe are too sick. Maybe they need a knee replacement, but their health just won't allow them to have surgery. They're not healthy enough to have anesthesia. And if we can provide them, even 50% pain relief, sometimes that can really improve the quality of their life without having to have surgery.
My approach to patient care is really looking at each patient individually, creating a care plan that is patient-centered, again, looking at what your goals are and what your lifestyle is, and catering a care plan to that patient specifically, not putting you in a box just because you have a diagnosis. And really working together, really truly try to build a family with my patients so that they feel very comfortable and that the plan of care is also in their hands. It's not just my decision.
The stem cell treatments are just one of the tools that are in my bag. I have a number of different techniques that I can use, either in the cervical spine or the thoracic spine or in the lumbar spine, and I try to pick the best treatment for that patient. If you only have one set of tools, you're going to be pushing that on your patients. I don't ever want to push things on patients. I want to give patients options. And when you have treatment options that range from extremely conservative to more invasive surgical approaches, you can come to a decision with your patient on what's best for them and what they're most comfortable with.
We do offer regenerative medicine as an option to augment surgery and as a potential treatment to help with wear. I feel that it's important that we now offer this treatment, as there are many patients that are looking for this option and having no good answer as to where to go. They end up oftentimes in clinics where all they get are stem cell treatments, and that may not be the right answer for them.